I'm Julie Halpert, and I'm a freelance journalist, and I am here with Allison Sekuler, talking about different ways that her company is helping those who are in the longevity industry. So, why don't you go ahead and give me your full title, since it's a mouthful?
Okay, sure. I am the Vice President of Research at Baycrest Health Sciences, and I'm also the Managing Director for the Rotman Research Institute, as well as for the Center for Aging and Brain Health Innovation. I hold the Sandra Rotman Chair in Cognitive Neuroscience, and I'm a professor of Psychology, Neuroscience, and Behavior at McMaster University and professor of Psychology at the University of Toronto.
Great.
That's only three mouthfuls.
Right. Better you to say it than me. So I wanted to just learn about the kind of initiatives that you're involved in and the many ways that you're helping entrepreneurs as they get into the sector. Can you give me just start with the first one, the one that you think is particularly significant?
So I'll focus mostly on the work that we're doing at the Center for Aging and Brain Health Innovation, or we'll call it CABHI, so it's less of a mouthful. So what CABHI is it's a solution accelerator. And really what that means is we're trying to find the best solutions in the aging and brain health space that are anywhere in the world and do whatever we can to get them into the hands of people who need them as quickly as possible. So this means we want to get them into the hands of people who are at risk for dementia or living with dementia or their caregivers, for example. And we're funding right now in several different thematic areas, including cognitive health, aging in the place of one's choice, caregiver support, care coordination, and then we have kind of an overarching theme which is related to funding solutions that can particularly help people of indigenous heritage or living in rural populations.
Great. And how long have you been around?
Me personally,
CABHI,
born in
yeah,
19...
CABHI.
CABHI is approaching its 5th birthday, and we were founded in 2015 with really generous funding from the federal government of Canada, the Public Health Agency of Canada with $42 million, and the what used to be the Ontario Ministry for Research, Science and Innovation. It is now the Ministry for Economic Development, Job Creation and Trade, and they provided $23.5 million. And then the Baycrest Foundation chipped in $25 million, and we had 30 plus coming from private and public sector partners. And so it was really the largest investment that the Canadian government had made in this space ever.
Wow, that's impressive. And tell me a bit about the value that you provide. Why are your services helpful to entrepreneurs?
Yeah. So what we try to do is not duplicate efforts of other groups that are out there. So we don't try to be like a typical incubator. We don't try to be like a typical VC firm. We try to figure out where are the gaps in innovation for longevity innovation, and then fill those gaps. And so, for example, some of our programs will be focusing on sort of early stage development of ideas, but not for people like me who are affiliated with universities who can get grant funding from, say, the national agencies. It's really more focused there on individuals who are working day in and day out with older individuals in the seniors care sector. So it could be nurses or personal support workers or occupational therapists, the people who really understand what the needs are and have ideas, but they haven't ever thought of themselves as innovators. So what we do there is we'll give some initial funding to help them get an idea off the ground. And in that case, we know that they don't necessarily have the background in, say, innovation. And so we'll provide more support in terms of our personalized services, support services for helping them build a business case and understanding how can they connect with scientists to be able to do the validation testing that they need to do. For example, what's a control condition and how do you make sure that you're testing the right kinds of things. In the next sort of phase, we work with groups that already have, say, minimally viable product, we'll call it an MVP, and those might be folks coming out of universities or clinicians or companies. And in those cases, there's already something to be tested, but the gap there that they have is they can't get it tested in real-world settings, in long-term care, for example, or seniors' homes, or even in the community. Because we're powered by Baycrest Health Sciences in Toronto, we can draw on all of the relationships that Baycrest has developed over its 100 years of existence. So Baycrest in the United States, people may not know, but in Canada, it's really one of the premier health institutions and long-term care institutions for old folk with a focus on geriatrics. So we're connected to basically everybody in Canada and North America. And so whoever needs to get connected, say, to whether it's a long-term care facility or a seniors assisted living facility, we can figure out who are the right partners and get the companies connected so they can be doing tests in those sites. So we're building the bridges, really, in those cases, which is a huge gap. We obviously then also providing funding in that case so that the folks on the ground, say whether it's at Jewish Senior Living Group in San Francisco or Hebrew Senior Life in Boston or Schlegel in Waterloo or York Care Center in New Brunswick, the people who have to do the work for the validation testing also have day jobs. So we provide the funding to bring in additional people to help with the trials and also for backfilling. So if a nurse is pulled off of his or her normal duties to do the validation testing, they can hire someone else to fill in.
Oh, wow.
So that's really the only way that you can get the validation testing done, because you can't expect someone to do two jobs. And then once things have gone through the validation trials, the next big gap that we saw in the innovation space is really around how do you now get your first buy? How do you get someone, whether it's in a hospital or long-term care or seniors assisted living or what have you, or selling direct to consumer, how do you convince someone to buy? So we have another program at the end of that life cycle that helps people sort of spread and scale. So those are across the entire life cycle. We're trying to fill where the gaps are and not duplicate efforts.
Right. So, given that you're based in Canada, you have a large presence in Canada, what has made you want to be involved with companies in the US?
So we're interested in innovation wherever it's coming from, because Canadian citizens are going to benefit from something that might be developed in Silicon Valley or Tokyo or Tel Aviv. It doesn't matter where it's coming from. If it's going to help the people in Canada, shouldn't we be looking wherever we should be finding these sorts of solutions? Sometimes the best solutions are in Toronto, and sometimes they're in Tel Aviv or Tokyo. So we just want to be finding the best solutions regardless of where they are. So although we're funded initially by the Canadian government and the Ontario government, we actually do support projects that are coming from anywhere in the world. If they're coming out of outside of Canada, we want them to have some sort of Canadian touch point. So we want them to be benefiting the people of Canada.
Nice.
Canadian innovations, on the other hand, can be tested in Canada or in the United States or Norway or wherever. And so part of the goal is to help the Canadian innovations spread internationally, but then also to find the best innovations anywhere in the world and help them advance the health and well-being of older adults in Canada.
Great. Well, I'm glad you clarified that, because I wasn't quite sure about that myself. What are examples of some successful partnerships you've had with companies that needed some of the services that you outlined and that you provided it and that really helped them to thrive? Can you give a couple examples?
Yeah, sure. So one actually is at the conference that we're at here today, Linked Senior, which is actually, as Charles, the CEO, mentioned, he walked 3 blocks to get to this conference. So we're funding something in Washington, D.C. Linked Senior is a company that is really aiming to try to improve the level of engagement of residents living in nursing homes or long-term care facilities. There are studies that show that the average amount of engagement that someone has in those facilities per day. Do you know this statistic?
No, I do not.
So how much time out of a 24-hour cycle do you think that an older resident of a nursing home is engaged in activities?
I mean, I would say at least a couple of hours.
At least a couple. That's what most people say. Would you believe 11 minutes is what the studies show?
So are they just sitting by themselves in their rooms then? Or?
They're sitting by themselves in the rooms, or they're medicated, or they're sleeping, or they're not being engaged. And it's not that the staff are neglecting them. It's just that there's not enough time in the day. If one recreational therapist is assigned to 60 individuals, how much time can you spend with any one of them?
Sure.
And so what Linked Senior does is it tries to automate the system in some ways for that engagement. And in theory, the approach that Linked Senior was taking was great, but they didn't really have any data to back up what the impact was. And so the funding that we provided through CABHI for the Linked Senior pilot allowed them to be able to show that not only does the system that they put in place increase the amount of time that residents are engaged, but there are all of these amazing benefits that come out of that. So for example, fewer antipsychotics needed to be prescribed. The stress levels of the staff decreased. The sort of health and well-being of the older adults increased. So all of these really positive benefits, and at the same time it was saving a huge amount of money. So when we looked at the amount of money that would be saved, for example, if every single long-term care facility in Canada were to adopt the solution, we're talking in the billions. And now you think about the United States being, a much bigger country. You can do the math there, that sort of impact. But Charles has said to us that he wouldn't have been able to get as many sales and as many investments if he didn't have those sorts of data to be able to show the investors or the purchasers what this kind of impact would be.
And what kind of companies are you interested in hearing from? Who would be good? I mean, who would you encourage to come forward? And what criteria or what types of companies? Do you have any preferences?
We're open. As right now, we're looking, as I said, in those sort of 5 areas of cognitive health, aging in the place of one's choice, care coordination, caregiver support, and aging in indigenous and rural populations. When we talk about those, though, it's fairly broad. So, for example, cognitive health is not necessarily just helping people with Alzheimer's improve their memory. It can be on the prevention side as well, because prevention, we think, is where a lot of the action really is going to be, because if we can delay the onset of dementia by just 5 years, we can decrease its prevalence by 50%, right? So even not preventing it, but delaying it is going to make a big difference in people's lives. So that's one area I think that's really ripe. Another area that we heard a lot about at the conference today is in the caregiver support. There are, across the United States, so many family members engaged in informal care of older adults living with dementia. And when we've done these analyses, and they've been confirmed in analyses done here in the United States as well, it comes out to about 18 billion people hours per year. 18 billion people hours per year in unpaid informal caregiving support just for older adults with dementia. And then you think about the stress levels of those individuals. And people who are caregivers of individuals with dementia are actually more at risk for developing dementia themselves. Not because it's contagious, of course, but I mean, it's just, they're not sleeping as well, they're not eating as well, the self-care is not there because they're caring for someone else. And we know that those are all risk factors for dementia. So the more we can do to address the needs of the caregivers will also be preventing dementia in the future. So I would just encourage anyone who's in this aging and brain health space with a great idea to give us a shout out. Our website is www.cabhi.com.
Great. Well, this is very interesting, and thanks for all the support you provide to this space. I appreciate your time.